If you have a child who is supposed to have anesthesia or had anesthesia, you may be worried of nausea and vomiting. This may sometimes look very worrisome. Although this can happen after surgery, there are many things that can be done to minimize this. You can expect to have nausea and vomiting in the child if they have certain surgeries on the eyes, ears, and throat. Nausea and vomiting also increases if the duration of surgery is more than 30 minutes. Here is what parents can do to provide information to the anesthesia provider. Do mention if your child has a history of motion sickness, meaning they get sick when they're in a car, bus, or a plane, or if parents themselves have felt nausea with their own surgery. Both of this increases the risk of nausea and vomiting in the child. Age is another factor. Teenage girls have a higher risk of nausea after anesthesia compared to teenage boys. If your anesthesia provider determines that your child has a higher risk of nausea and vomiting, then they do administer additional medications to prevent nausea. In spite of treatment with multiple medicines, some children do end up having nausea, and some of them can even have troublesome nausea. If you're wondering what is the difference between nausea and vomiting, nausea is stomach discomfort and the sensation of wanting to vomit. Vomiting is the forcible emptying of the stomach contents. Nausea may actually predispose to vomiting. If nausea occurs in the hospital after anesthesia, there is a safety net of the hospital or the clinic or nursing homes if you are in India taking care of the child. Some children can have nausea or vomiting after they come back home from the hospital. In such a situation, it can be distressing and confusing. Here are a few things that can be done to prevent or treat nausea at home. The straightforward thing is to follow advice provided by the anesthesia and the surgical team. It is important to watch out for any restrictions that have been placed on the child's diet. In most outpatient surgeries, meaning when the child is sent home the same day of surgery or the next day, the medicines provided during anesthesia should take care of nausea, and children do not typically get a nausea prescription medicine. It is helpful to be proactive and provide medicines, if any, prescribed prior to the child having nausea. Most of the times, children are fed some drink before sending them home. It's usually water or juice. Children should be encouraged to drink as long as they can tolerate and allowed based on their surgery. Having more fluids is beneficial to reduce nausea. Dehydration can contribute to children having nausea. Although children with nausea are hesitant to take anything by mouth, encouraging them to drink can be beneficial to reduce nausea. It is a good idea to introduce food slowly, starting with a semi-solid food or khichdi, and then watching for any problems with nausea and vomiting will help reduce further nausea. A gap of 1 to 2 hours between food is important to watch for nausea and vomiting. Slowly transition back to normal diet if the child starts tolerating semi-solid food. Adding sugar to water can help reduce nausea, although it is debatable. As long as the child does not have any reason not to have sugar water, like diabetes or any other reason, it is beneficial to give sugar water. Having sugar water prior to surgery is also beneficial to reduce nausea. Aromatherapy can be tried to prevent nausea. Peppermint oil can be inhaled and it can actually help prevent nausea. Ginger is another natural agent that prevents nausea. The benefit of ginger is it is easily available and can be used in many different ways. There are ginger candies, ginger oil. Ginger can be boiled in hot water and consumed. Ginger ale is another option. Chewing gum is another good choice to reduce nausea. Older children who can chew safely can be offered chewing gum to reduce nausea. There are medicines that can be taken to treat nausea like promethazine and dimenhydrinate. Promethazine is the generic name for Phenergan and dimenhydrinate is the generic name for Gravol. In many countries, these are easily available in the pharmacy without a prescription. Adequate precautions should be taken since these medications do carry some side effects like making children more sleepier and other side effects. Talk to your doctor or your hospital or clinic or wherever you had anesthesia in case there are any questions, there is ongoing nausea or vomiting, dehydration, or if there are any additional concerns. I hope you found some value with the video. Do like and share. Make sure you smash the subscribe button and follow us for additional videos on child health and wellness. Take care and have a great day.